As an undergraduate college student, I can confidently say that my checking account will reflect that I am by no means a billionaire. But as an undergraduate researcher, I'm willing to bet a responsible amount of the money that I do have that at least a third of this audience has experienced some form of inflammatory response in their life. The pain and redness from an allergic reaction, the swelling and loss of function from an injury or infection are all signs of inflammation that we're familiar with. And for many of us, it's often a one-off occurrence that fades with medication and has little impact on our lives. However, for 125 million Americans with some chronic inflammatory condition like sickle cell disease or vasculitis, everyday aspects from air pollutants to stress to even hydration and exercise can cause severe flare-ups. And the frequent bombardment of immune responses on their blood vessels poses a serious risk of stroke that kills millions every year. You see, your blood vessels are lined with endothelial cells that maintain the structural integrity of your vascular system. And when you have an inflammatory reaction, your immune system responds by releasing pro-inflammatory cytokines that help fight off the infection, which is good in moderation, but in excess, they can gradually wear down endothelial walls, removing the availability for cell stabilizers and permeability regulators like S1P from binding to the necessary receptors to do their jobs of upholding blood vessel structure. The vessel lining becomes so thin that eventually they rupture, resulting in hemorrhagic strokes. Fortunately, with the utilization of a recently developed drug delivery nanoparticle known as a nanoemulsion, we can provide stable vehicles to load and release S1P in larger doses to overcome their natural downregulation and continue binding with receptors to maintain blood vessel strength. The term emulsion may be familiar to you as they are used quite commonly in foods as the homogeneous mixture of oil and water. Now, it's common knowledge that no matter how much you shake or blend the two components, they are immiscible and will eventually separate. However, when you put enough energy into mixing the two in combination with the proper ratio of other chemical stabilizers, you can kinetically force them into stable micellar particles on a nanoscale. These nanoparticles are coated in a phospholipid membrane, not unlike the cells within our own bodies, and with an oily core, it's possible to load these particles with S1P and lipophilic drugs similar to it and use targeted drug delivery therapy to chronically inflamed endothelial cells. This approach, if successful, could potentially be adapted for other bioactive lipids or small molecule therapies, ultimately laying the foundation for future studies, furthering precision medicine for inflammatory diseases, and opening the door for millions of Americans to experience an improved, more fulfilling way of life.